I'm Dr. Lewis Clark, and in this video, we'll talk about 4 methods used to diagnose and track brain injury and performance, and why one of them stands out above all the others. Up until recently, a concussion was diagnosed simply by listening to the patient's symptoms rather than any objective testing. But isn't there a more scientific way to diagnose brain injury than by the subjective symptoms of poor focus and concentration, and those other descriptives we covered in the first video? There are imaging tests. In the past 50 years, we can, for the first time in human history, look inside the human body without cutting it open. Now we can look at the brain inside the skull with CAT scans and MRIs. Unfortunately, unless there's a major brain injury with bleeding or stroke, these tests don't usually show anything abnormal in patients with concussions, because the concussion damage is microscopic. These tests are just pictures of the brain, like a photograph. They don't show what parts of the brain are working or not working. It's like wedding pictures. You can see the whole group, but you can't tell which individuals in the picture are dysfunctional. So these imaging tests really have limited value for concussions. Cleveland Clinic utilizes something called the IMPACT test. It's approved by the FDA. Essentially, this is a set of tests that measures memory, attention span, and visual and verbal problem solving. Isn't there something more scientific out there than a picture or a set of memory tests? There's a test of brain electrical integrity known as WAVi. It was developed by a team at University of Colorado to measure brain performance. It consists of a soft foam helmet with electrodes, and this is connected to a small laptop which is programmed to record the tiny voltages produced by the brain. It's portable, so it can be taken on site to an athletic event, or used in a trainer's room, or in a doctor's office, or a therapy clinic. But what does it do? Well, it has programs for assessing standard concussions, but also for ADHD, depression, cognitive screenings. The WAVi can actually show the brain's electrical response to an outside stimulus, like a noise, for example, and how long it takes for that noise, once it hits the ear, to be transmitted to the brain. A concussion slows the signal down and decreases its voltage, and there you are. You have your unequivocal diagnosis. There is so much more that can be done with this WAVi: visual response time, brain integration, measuring every fast problem solving with a test called flanker and trail making. Each of these tests the speed of processing and gets at the issue of concentration, focus, and distractibility. All of this is compromised in concussion. This WAVi can objectively evaluate that. Now that we can use the WAVi to unequivocally diagnose concussive brain injuries, no more guessing. Can it also tell us when the brain has recovered? Yes. With follow-up WAVi testing, we can know when the voltages and delays return to normal values. Now we can be much more confident that the brain has shown significant recovery and that the athlete can return to play. No more guessing. This is even better if the athlete has had a baseline WAVi, for example at the beginning of the season. Then we can be even more confident that a change in WAVi after a bell ring represents a significant injury, so we don't just blow it off. Exciting, huh? And I'll talk more about that in the next video in the series. Thanks for tuning in.